segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Well, welcome back. We're talking about signs and symptoms of an opioid overdose. We have Angela Stander here, Prescription Drug Overdose Prevention Coordinator with the Utah Department of Health. Thanks so much for being with us. I don't think a lot of people realize how serious of a problem this is.
Yeah, absolutely. We rank 7th in the nation currently for these types of drug overdoses, specifically an opioid pain medication overdose.
And how does it usually happen? You might have a medical condition, use the opioid, and then get...
Yeah, absolutely. A lot of people take opioid pain medications for chronic pain, chronic back pain from different injuries, or after surgery for an acute injury as well. And then some people abuse them illicitly if they're misusing these types of medications. So that's a lot of ways that this happens. An overdose can happen when you are using it as directed. Even though it is prescribed by a doctor, it's perceived as safe. It's still a very dangerous substance, and overdose can take place.
Now, there's some events coming up to help educate all of us, right? Tell us about that.
Yeah, absolutely. We encourage people to not hold on to opioid medications after surgery. If you have leftover expired sitting in the cupboard, we find that that's where there's a lot of risk for misuse and abuse, people stealing those medications. So we encourage you to get rid of them. Clean out your medicine cabinets. There's permanent drop boxes throughout the state where you can take them in pharmacies and police departments. But also on April 29th, there's a National Drug Take Back Day, so there'll be events throughout the state to dispose of your medications.
Okay, and I think we have some items here on the screen we want to talk about really quickly. More than, what, 6 Utahns, more Utahns are killed by opioids than in automobile accidents. That's a staggering fact. 6 Utahns die each week from an overdose, and prescription opioids are just as dangerous as heroin.
Yep, absolutely. So most people don't realize that what's in their cupboard, what they're taking home from the pharmacy, has the potential for as big as a risk of heroin. So it's important that people understand the risk of these substances, even though they are prescribed by a doctor.
Yeah. Well, Angela, thank you very much.
Thank you.
Important life-saving information there. We appreciate it.